ARCH is a community health response team that can respond to a number of needs in the community. It could be for a mental health crisis, it could be for a homeless issue, it could be for a food insecurity issue.
And they're going to be able to intervene in a way that law enforcement or other providers may not be able to, because they have not only the social work component to it, but also the paramedic piece to it.
ARCH is looking to provide a more specialized approach to 911 calls that don't fit the criteria for a police or EMS response.
What makes them unique is that they're an immediate response resource in our community, whereas we have some other resources, but it may take them up to an hour to respond to the scene, where the ARCH team could respond within 5 to 10 minutes.
The response for ARCH begins with the 911 dispatch center, and they'll receive a call, run through their regular line of questioning, and from there determine this is an ARCH call or this still needs a PD or a EMS response or fire department. But if an ARCH call is triggered, they'll screen for safety reasons and eliminate any kind of threat to staff, and they'll dispatch a social worker as well as a medical professional, so an EMT or a paramedic.
We're going to assess the situation. We're going to assess what is going on with that individual, determining is this person in a mental health crisis? Are they suffering perhaps from withdrawals from substance use? Figuring out what that person needs.
We see mental health issues and challenges on our campus community just like in the general community. It does seem to have increased over the last several years, which is why at ISU Police we partnered with Mary Greeley on this initiative. We also have our own mental health advocates on the police department, and we've added robust counseling services and added more staff to our counseling team. We're making sure that we have the adequate resources to serve this community.
We look at it as kind of the old model of where the doctor used to go to people's houses and visit them and take care of their needs, or the home health nurse model where someone would go to a person's house and evaluate their medical needs. So this is really no different than that, but it could be socioeconomic needs, it could be medical needs, it could be mental health needs. So we really feel like this is a great resource for those in our community that could be struggling.
Law enforcement wasn't designed to be a mental health asset, mental health resource. Now our officers have great training and we're there in the interim, and there are cases where law enforcement should respond, but the vast majority of our mental health cases, people are just looking for resources, they need help, and unfortunately our community doesn't have all the help and resources it needs, and so this will just add that one piece that hopefully will make a difference.
I think about what ARCH is going to be able to do, to be able to fill in the gaps, to be able to catch some of the folks before it gets to be a crisis level, or where they maybe are calling in suicidal, that we can reach these folks and be able to get them the proper resources. In my mind, it's not just putting a Band-Aid on the problem. This is long-term sustainability.